If you've been told to eat fewer carbs, but your body seems to be craving them all the time, you're not failing. Your body is trying to tell you something. I'm Dr. Berens, a weight-neutral family physician that specializes in managing your metabolic health without restrictive diets or focusing on weight loss. And today I'm going to talk about what drives carb cravings in conditions like prediabetes and how to work with your body, not against it, to feel more in control. So, first of all, glucose, which is sugar, is our body and brain's preferred fuel source. So if you do not have enough glucose in your bloodstream available to use by your body and brain, your body is going to increase hunger and specifically cravings for carbohydrates or glucose to bring in more glucose from food. The first thing to always think about when you're craving carbs is, are you eating enough? And a lot of patients assume that they're overeating, and particularly patients with prediabetes have probably been told they need to cut carbs or cut calories or lose weight to manage their condition. So if you are not eating enough, whether that's not eating enough carbs specifically or not eating enough food in total, this is going to increase your cravings because you're hungry. It is possible to be malnourished and be pre-diabetic, and this is something I think a lot of patients don't understand. So it's really important to make sure that if you are craving carbs all the time or feeling hungry all the time, first check in, are you actually eating enough, and are you eating enough on a consistent, regular basis? Our body needs fuel throughout the day. Typically at about 3 to 4 hours, we are starting to use up all of the available glucose stores that we have, and we need more fuel coming in. And so if you're not consistently on a regular basis eating enough fuel, you are going to feel hungry and you're going to feel carb cravings, and those are very normal, and it's important to respond to those. So that's number one before we get into any of this. If you are eating enough consistently, but you're still struggling with carb cravings, this is a sign of insulin resistance, which is the precursor to prediabetes, which is the precursor to type 2 diabetes. So when your body is insulin resistant, what that means is when you eat glucose and your pancreas releases insulin, your body is not responding to that insulin efficiently to be able to lower your glucose level in your bloodstream. And so then what your pancreas has to do is produce a higher amount of insulin to be able to lower your blood sugar. Now, insulin is a storage hormone. So what that means is it's going to promote the storage of glucose as fat. Now, the problem with that is if you need glucose later, like for example, if you've gone several hours without eating and you've depleted your glucose stores, it is pretty slow. It's a pretty slow process to turn that fat that has been stored back into glucose. So that means there's less glucose that's freely available for your body to use, which means you're going to start feeling hungry again. And this process actually compounds on itself because the more fat that you store, the more insulin resistant you become. And so it can become a cycle that's difficult to break. So the way to reduce those carb cravings after meals when you're insulin resistant is to ensure that you're eating balanced meals on a regular schedule. And when I say balanced meals, I mean that meal contains protein, fat, carbohydrate, and fiber. Eating protein and fiber specifically, along with your carbs, means that you are going to absorb those carbs more slowly. And so the amount of insulin that you have to release to get the blood sugar level down is less. And that means that less of that glucose ends up getting stored in an inaccessible way as fat. So then later, when you need more glucose to be freely available, one, you have some for a longer time because it was absorbed more slowly. And two, less of it is stored in that inaccessible way. So many people are able to control their carb cravings when they have insulin resistance just by making some adjustments to the nutrient balance of their meals and the timing of their meals. And this is something that I often work with patients and their registered dietitian on to help them work to improve that balance. However, some people still do struggle despite making all of these changes. They've done everything they can. They're eating regular, consistent, balanced meals that have enough of all of the necessary nutrients, but they're still struggling. And in this case, there are medications that can be helpful to manage insulin resistance and to reduce those inappropriate cravings. But before even considering medication, it is very important to ensure that you're eating enough, that you're eating consistently, and you're not trying to artificially suppress those very normal signals that your body is giving you, because you can become malnourished if you're suppressing your hunger and not eating sufficient nutrients throughout the day. So I hope this was helpful. As always, I'm a doctor, but I'm probably not your doctor. So if you have specific questions about your medical care, always check with your own doctor. And thanks for watching. If you hit subscribe, you can see more of our videos with more guidance you can trust, and visit vitafamilymed.com if you'd like to become a patient.